चल है डॉक्टर सुनील मित्तल डॉक्टर सुनील मित्तल डॉक्टर सुनील मित्तल
Dr. Sunil Mittal, sir.
Yes, please.
Sir, you must be knowing that the session is an extempore and the slides shared with you are for the reference, right?
Okay, so there'll be no slides there. Hello?
Yes, sir. Yeah, sir. Yeah,
So
sir.
there are no slides being put on screen?
Sir, if you have it prepared?
No. Your slides, which you gave me for
No slides, sir. No slides.
Okay. So then thanks for telling me, because then I better open up those figures.
Okay.
So Dr. Anand, Dr. Reddy, namaskar to everybody.
Good evening, sir.
Namaskar, sir. Good afternoon.
So अगर आपने कहीं पर भी राज करना है तो आनंद के साथ रहो.
Shrishti, like I had mentioned to you earlier, I will just share the things. I've just got my section of the slides taken out.
Okay.
About 4 to 6 slides. I'll just go through that.
Yeah.
Like I said,
That's fine, sir. That's fine.
Okay.
सुनील, अगर तुम्हारे को कोई स्लाइडें करनी है तो उनको बता दो, वो कर देंगे सामने.
Yeah, if my section of the slides, if they can be put up, because they've got graphs.
Okay.
ले लो उसको.
Shrishti, you can put in that case.
Okay.
Right.
So do you want me to share it for you or you would be sharing?
No, you share it, please. You share
it, please. You can mail it to me. I'll take it from
there.
there.
No, it is there with you, Shrishti.
Okay.
Same slide.
Same slides. I don't want anything else. What you had sent me, that's fine. The rest, I see those have the figures and the graphs, and I'll build on it. That I'll do extempore.
All right. Okay.
I don't think I have slides, isn't it?
Pardon me?
Srishti, I don't think I have slides.
Anand sir, you in your case slide will not be required because it's going to be a panel discussion.
Okay. Yeah.
Yes.
Sir, 3:30. It's 3:30. हम start करें? Everybody is ready?
Yes.
Okay. All right. May I request everyone except the panelists to switch off your audios and videos? Thank you. All right. 3, 2, 1, and start.
Hello everybody. Greetings from Heart Care Foundation of India, and also Elcom, who is organizing this particular program along with IJCP group. I'm Dr. K.K. Agarwal. I'm currently the president of Confederation of Medical Association of Asia and Oceania. Today, we are discussing an important subject. When I was in medical college, I was taught I need to be scientifically correct. So our job was just to read science and treat the patient. Then over a period of time in 2002, I was told I also need to be ethically correct. So I need to read all the MCI ethics regulations. And now today, in the last 1 decade, I have been told that I also has to be legally correct. So these three things are required. Ethics, Medical Council of India, as on today, till NMC ethics comes, we still follow Medical Council of India ethics, says I need to be punctual. That's 3.3. I need to be transparent in my fee, and I need to keep up my records. Now, these three have become very, 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 very important. With the COVID era, there are further changes. The Telemedicine Act has come, and teleconsultations are allowed. Now, every 5-bedded nursing home today says he's 50-bedded, 500-bedded. And a doctor who is practicing in one state says, I'm a global doctor. Because anybody globally can consult him. For him, he is no more a doctor of Delhi or Punjab or Amritsar. Now, every doctor is a global doctor. At a click away, he can consult his patients. There used to be doctors' clinic timings. Now, clinic timings are also flexible. In one click away, he can tell the patient whether he is on vacation or not, or whom he has given his practice in his or her absence. So therefore, in a telemedicine, we are looking for avenues which are economically viable to me. If I practice in a hospital today, I know in the last hospital I used to practice, they used to charge 25% of my fee for allowing me to use their room to see a patient. 25% of the fee is a huge amount of money. I want, like a hospital gives me patients, so I need a telemedicine platform who gives me patients, who provides me satisfaction. Hello. And my patient a satisfaction. Hello. Who gives me an opportunity to correct my mistakes, and which reduces my time, maintains my secretariat's job, my record-keeping job, and is MCI compliant. That is the subject of today. And the subject of today is how telemedicine can help in the practice of neurology and in the practice of psychiatry. We will focus on why should we choose a platform and not go to like phone call or a WhatsApp call. Remember, there is a Supreme Court judgment very clearly saying telephonic consultation should be avoided unless it is a must or urgent. So therefore, a WhatsApp call or a telephone call can only be accepted in an urgency, not in a routine way. In a routine way, you definitely need a platform. And today, we are going to have a discussion on a platform. With that, we will talk about everything about telemedicines. So I have with me today Dr. Sunil Mittal, Dr. R.V. Anand, Dr. Rajshekhar Reddy, Dr. Vishal Chabra, and Dr. Dhairashil. And I will be introducing them one by one as we get into the program. So first of all, the purpose is to talk about focus on neurology and psychiatry, but the same will be applicable to other specialties also with that. So I now invite Dr. Sunil Mittal, who is a consultant physician Delhi, a close friend, a doctor of many celebrities in the country, successfully organized a very successful conference of which I was also a part to present evolving future of patient care in psychiatry. Why telemedicine is important. It is going to be the future. Whether it is today or tomorrow, telemedicine is going to stay. Over to you, Sunil.
Thank you, Dr. Agarwal, and thank you for the kind introduction. Um, Telemedicine, and for me, telepsychiatry, the application of telemedicine in mental health and psychiatric service delivery, is something which is very dear to the heart, because as far as this is about 20 years ago, we were experimenting with telepsychiatry. In 2003, we did some project work looking at world backing and funding at that time, and so on and so forth. And through these last 2 decades, we have done some bit of work connecting rural areas through telemedicine, been part of some NGOs and other bodies who have been doing this work. And currently, I am also the Asia Pacific Director of the World Federation for Mental Health. We are trying to see how services can reach, the interior or people where psychiatric services don't exist. Application to psychiatry, although we in this 10 minutes or 5 minutes we'll look at it. But the fact there is that, just for our understanding, almost 15% of people, general population, require psychiatric help. The National Mental Health Survey says about 13.7%, which is severe mental disorders and common mental disorders, common being anxiety, OCD, depression, severe being bipolar, schizophrenia, addictions, paranoia, and the various other types of psychosis. So 13.5% is a large figure, which we're talking in terms of more than 15 crore Indians. That's a very large figure. And India representing a diverse geographical location, just like any other part of the world. For the developing countries, for India, other countries like Africa, or a lot of Asia, Polynesia, South America, the challenges are that we have very few mental health professionals. India, we have about 6,000 psychiatrists. 6,000 psychiatrists, 15 crore people requiring help. And then we have got maybe just about 2,000 clinical psychologists. So you can't even talk in terms of psychologists trained in mental health to provide or extend this help. Out of the 6,000 psychiatrists, maybe 500 are in Delhi NCR, another 500 like that in Mumbai and some other metro cities. The government's district mental health program, which looks at providing one psychiatrist in every district of the 650 plus districts in the country, has reached less than half. Understandably, because the manpower shortage is there. Now, technology has always come to rescue, to step up, to help scale up, to help provide services in every sphere, whether it was emails or it was in whatever connectivity, as we can see, whether it's on our smartphones. Looking at the gap the psychiatric services and actual population has, which is referred to as the mental health gap, which is huge, which is actually the mental health gap in India is more than 80%, because clearly very few people actually get psychiatric help and very large number requires it. So this is a gap, and the WHO has got a whole document out, a whole program, and if you have to, the development goals have to be reached for any economy, any country, healthcare becomes very important. Telemedicine is here to stay. Having been part of various task forces for the last major part of this decade, which has been on telemedicine, we made some recommendations to the government, and our associations, societies, and other associations did. And it was on the 25th of March this year that the telemedicine guidelines were announced. They form a part of the MCI, now the NMC guidelines on medical etiquette, the ethics for doctors, and they also form an independent policy document. Then in psychiatry and mental health, the National Institute of Mental Health and Neurosciences, NIMHANS Bangalore, along with the Telemedicine Society of India, in the month of May, released telepsychiatry guidelines. So very quickly, the psychiatric fraternity with the Indian Psychiatric Society, NIMHANS, and the Telemedicine Society of India, we released the telepsychiatry guidelines. Then how do you apply telemedicine to psychiatry? Having said this, let's just revisit telemedicine, what it's all about. So telemedicine is obviously using information technology to provide diagnosis, treatment, prevention, emergency handling in a very limited manner, also research or interventions for injury, the whole gamut. The telemedicine policy says you could use any platform, whether it be a dedicated platform or whether it's on a chat or an email or whatever, or WhatsApp. So it doesn't specify the technologies. But then, like Dr. Agarwal pointed out, there are some court rulings to limit some of the technologies. There is also the guidelines also incorporate what services can be provided, who is the RMP, registered medical practitioner, who can initiate such a consultation, whether it is patient initiated, caregiver initiated, or a healthcare worker initiated, as well as what sort of medicines you can prescribe, whether list A, list B, list C, and so on. And the narcotics and the psychotropic substances are limited in the prescription. You can, and initially none could be prescribed online. But then again, the Indian Psychiatric Society, and as part of that discussion, we took it up, and on 25th March, we had the telemedicine policy. 11th of April, we had order that some of the medicines like benzodiazepines, which are also covered under Schedule X or in the NDPS, could be prescribed. Very limited number, 1, 2, or 3 of them. Some anti-epileptics could be prescribed. So this order came out on the 11th of April. If you look at telemedicine totally, it's here to stay. So it is not just something which is an offshoot of this pandemic. The pandemic has only made it happen. Last many years, we're talking about it. Our last discussion in the Ministry of Health in 2017, they said, well, you can't just have it for psychiatry. We need it for every discipline. But then the pandemic just precipitated it and the policy came out. We also know this. Here are some figures that the telemedicine market in India is going to reach 5.5 billion by 2025. Next 5 years, $5.5 billion US equivalent is going to be the value of the telemedicine market. It's huge because everybody today, like I practice telepsychiatry, I do all my consultations online as of now. And of course, there'll be some real life consultations in time to come. The figures are growing and everybody wants convenience. You don't want to commute, you don't want to travel, you save on time, that's a patient. And for the doctor also, it's convenient. Record keeping is ensured. You have your record, you can video record it with the consent, of course, but your records are shared. If you make an e-prescription, it's all well recorded, documented, and therefore it covers right from the ease of seeking a consultation to the ease of making a prescription, documentation, and also communication between healthcare providers. If I want to speak to another doctor, refer to another doctor, it's far simpler. The patient finds it very convenient from the home. Time is saved. So therefore it's going to grow. And also, it is said that telemedicine could save, one is the growth. The McKinsey report says that it could save India equivalent to $4 to $5 billion US every year. Now, one is the growth in the market. That's something separate. But here is a saving for the economy in GDP, in terms of travel, fuel, whatever, man hours. And then, of course, that most healthcare providers like me believe that even after the pandemic, almost 30 to 40% of the OPD is going to continue through teleconsultations. In psychiatry, I think it could be even 50%. Vishal is going to talk later in the day, but we could have up to even 50%. I find it very convenient. My patients find it very convenient. Yes, some patients miss the touch of actual interaction, so do I. But in psychiatry, most of our examination can be done online. If I may have the next slide, please, for the figures. Yeah. So teleconsultation is the way ahead. If you look at the growth story, if you look at the market size, telemedicine and specialty, specifically to psychiatry and mental health in telemedicine, is expected to grow rapidly at almost more than 34% annually for the next 5 years. So the cumulative average growth rate is going to be huge, 34% or more. So it's going to be huge growth. We have already seen it happen. Many companies have come in for counseling. At our center, before the telemedicine policy came in, which was applicable to an allopathic practitioner like me, we were doing many online consultations for counseling and psychotherapy. We've been doing for a decade. We had a platform design and we were doing it. We were able to reach people, like I said, in the rural area, in some of the urban disadvantaged community area also, sitting in the clinic. So there was an exponential availability of the healthcare provider. So like I said, it's here to stay. So for all of us to get familiar and join in, get familiar with the telemedicine policy, get familiar with the India growth in telemedicine story, and join the bandwagon. It is fueled by a massive growth in mobile data consumption, because we notice the smartphones are growing. And also there's a 40% annual growth for the next 5 years that's likely to be sustained. And this is obviously driven by increased accessibility and affordability. So there is a growth in the smartphones, growth in the electronic devices on which you can reach your clients and the clients can reach you. And like Dr. Agrawal said, you don't even have to pay a percentage of your fee to a clinic where you could be. It's ease for everybody. Smartphone penetration is high in our population and it is increasing and is expected to be almost 1 billion out of the 1.4 billion projected population in 2025. That's a large number, so everybody could have access, point of care interventions and counseling, therapy, as far as psychiatry is concerned. Next, if I may have the next slide, please. Yes. So if if you look at doctors who were surveyed, this is the C2C teams, the Connect to Clinic teams, primary research, almost 2/3 believe that it is here. So it is here actually. People like me who have been working with software, getting some platforms designed, now will find it so easy when the platforms are existing. I don't need to go and reinvent the wheel, have an independent software provider, or have my own IT team who are doing it. They have to keep reviewing it. They have to keep, as technology changes. But here is a robust platform like C2C, which is going to be available. And then, of course, like Dr. Agarwal said, that it provides not just the ease, it provides the robustness. It also provides a back end of all the admin care that can go in. And when 2/3 of doctors believe that telemedicine is going to grow, telepsychiatry is going to grow hugely, hugely. And teleconsultation is going to be the norm. Psychiatry adapts very easily. I will just share. Before the lockdown, we anticipated the lockdown in the first week of March. And by 12th or 13th of March, or Holi, that was 10th of March, just before Holi, 8th of March, we had our systems in place. We were ready. My team was already ready, providing consultations, which followed whatever existing guidelines were. And when the 25th of March, the telemedicine guidelines came in, we went absolutely full out. Everybody was online from our hospital. And we are there. And we could sustain the practice, we could sustain what was being done, we could sustain admissions in the hospital in a very controlled manner through the pandemic, and we could sustain patient care. Most importantly, patients found it easy. Patients found it easy to access us even when there was absolute lockdown. So that's what telemedicine can do. Next slide, please. See, the biggest challenges to mental health care across the world, more so in India, we refer to them or sometimes as the 4 A's. First is awareness. People are not aware they've got a psychiatric problem. Telemedicine can be used to generate, platforms can be used to generate awareness in communities, in societies. Second is accessibility of care. How to make it accessible? In fact, the World Federation for Mental Health has a World Mental Health Day in collaboration with WHO. And the theme this year is accessibility to care, mental health, accessibility to care, everyone, everywhere. So that's not possible in physical world. That's only possible through a IT-driven platform. So accessibility. So first was awareness, second is accessibility, third is affordability. It makes it affordable. People save on man hours. If a patient has to come in, somebody has to lose wages for that day to bring that patient in psychiatry or even in other disciplines. So time is saved. So affordability, fee structure can change, affordability. And of course, the last one is the availability of services. So awareness, services being available, they being accessible. So even if I was available, I was not accessible in the lockdown, being accessible and affordable. So these are the 4 barriers of care which can easily be sort of overcome through telemedicine. So access to specialist treatment exists, reduction in high or indirect cost, and also easy to seek second opinion. You could have the person online with you, you could refer across, you could do so many ease of second opinion. Risk of exposure during pandemic or risk of exposure or even the most vulnerable population, the geriatric population, find it difficult to come in, so on. And anonymity, confidentiality. The only caveats were we often require a GP to be in a circuit to be able to examine the patient, say a geriatric patient or somebody else who requires examination. And since we need to follow the Mental Health Care Act, in case anything involuntary is to be advised, an actual examination is required, and you can talk to the family's GP, and then it's a healthcare to healthcare worker provided telecommunication. So benefits being ease of connecting to the specialist, good saving on logistics, you don't have to travel and stay, quick access to accessibility, hassle-free, touchless consultation, no infections, and one-to-one consultation, safeguarding identity and confidentiality. All that is provided. Next, please. So like I said, the number of psychiatrists is less, and psychiatrists are more likely to find telemedicine easy to work with. Our specialization adapts very easily to telemedicine. I've been speaking to my colleagues in Europe and the US and Africa. So they all say, well, they're using whatever platform the patient finds convenient. So it's not platform driven, it's patient driven. But if you have a good platform and the patient finds it convenient through an app, it becomes even simpler. It stores your data, it stores everything, it makes your appointments and makes your life easy.
Can you be a little bit fast?
Yes, the last slide, please. Or the second last. It is more reliable for diagnosis. So video conferencing is the way forward, because you could, and in psychiatry for the nuances, we prefer a video consultation than just a chat or an audio consultation. Next, please. So that's my last slide. So what it means, I'll just wrap up in 2 sentences. For psychiatry, telemedicine is a boon. It is going to be here. It's going to stay for all mental health professionals, whether they're psychiatrists, psychologists, or counselors. And it's something we have been waiting for. And I hope and I wish that more mental health care service providers would join in. Thank you.
In psychiatry, many patients don't want to come to the clinic. They don't want to come to the hospital, that they will be identified. And if they get a care from their home, nothing like it. So thank you, Dr. Mittal, for elaborative discussion. And we will have discussion in the last. In the meantime, now I go from psychiatry to neurology. And in neurology, you can save a lot of time and you can save a lot of money. 2 o'clock in the night, a patient says, I'm having paralysis of the face. You say, come to the hospital, gets admitted. It's a Bell's palsy. And you can easily find out on the net when you are doing a teleconsultation. Many of the things, like you can do it on the spot and diagnose specifically. If you want the patient to reach within the TPA window, he should be able to reach. So I invite Dr. Rajshekhar Reddy, who is a senior consultant neurologist in Delhi, and he is also the director of neurology at Max Hospitals in Delhi. Over to you, Raj.
Right. Thank you, sir, for that kind introduction. And I will just share my screen if that's okay with everyone. Is that all right? Can people see that?
Yes. Make it
yeah. So basically, what I want to say is that Dr. Sunil Mittal has made my job humongously easier. I think I should send all my patients to him first also, so that everything is done before I have to do anything. So I think Sir's covered these points beautifully. And I think that we started off this entire thing by thinking that necessity is the mother of invention. And we thought that this pandemic has actually caused this thing to happen. But like Dr. Mittal said earlier, I think this was going to happen anyway. It just got accelerated. There was an acceleration which happened in this last few months. So I've used telemedicine as far as maybe 2005 and 2006. At that point, I was a consultant in Fortis in Noida. And we used to do a lot of epilepsy outreach clinics to a lot of places in UP. We were covering smaller towns, and we had a lot of doctors on this panel who used to consult us via telemedicine. And at that point, you had to go to a room where there was this apparatus, and the connectivity obviously was not great. But even at that point of time, we saw the utility of this, and we realized that over the years, as technology got better, this would obviously become a big thing. And that's exactly what has happened in the last few months, at least. Now, specifically for neurology, like Dr. Mittal said, there are only 6,000 psychiatrists in the country. We have about 1,800 neurologists, and that's a very, very small number for a population of 1.4 billion. And here you can see, again, most of these people are concentrated in bigger cities. And in the rural area, obviously, where there is a lot of disease burden, there are many, many people who cannot get access to a neurologist. So almost a billion people in this country live without direct access to a neurologist. So this acute shortage of neurologists is not going to be overcome in the next few years. It might take a few decades to actually get the correct numbers for a country as large and as diverse as ours. So I think that something like telemedicine is going to make a huge difference to all these people who are in far-flung areas, who cannot come directly to meet a doctor, and these people who did not have access to anybody of, let's say, a certain knowledge or a certain skill set, can now today access all these people. Now, obviously, in the past, we've realized that telemedicine is useful but underutilized, and Dr. Agarwal also clearly mentioned that certain situations where you have a patient coming to the emergency with stroke and status epilepticus, now we use video chats with our colleagues who are in the emergencies, and sometimes it will come, a patient will rush to the emergency saying, I've had a stroke. And when the doctor there shows you a video of what is happening, or the patient shows you a video of what is happening, then you know this is only a Bell's palsy, and this can be managed easily, and you don't have to ask the patient to panic and run and go into the emergency and expose themselves to several other patients or expose other patients to them. So there's a great advantage in some of these things. We have situations where children have seizures at home. We know that when these seizures happen, you can easily diagnose these seizures, ask them to do certain things at home. Obviously, in such situations, when a patient is very sick, you want them to come into the hospital and be treated properly and physically, but at least the correct advice can be given to them even when they consult from home remotely using these technologies, using these platforms. Um, and one of the things is, of course, some of us, and especially so psychiatrists and neurologists, can actually see certain situations where they are clearly not seizures. And you have a person who's panicking at night telling you that my child is having several seizures. When you look at these videos or a chat with that time, you know that these are basically pseudo seizures or paroxysmal non-epileptic events. And then you can advise them that, you relax. All we need to do is take care of the situation with such intervention, then the patient will be fine. So it's very reassuring to patients also to be able to see a doctor, to be able to tell a doctor from the comforts of their home that, look, this is what is happening to me again and again. And this is obviously a great advantage both to the patient and the doctor. And like Dr. Mittal mentioned, that the elderly who are the most vulnerable in our population are possibly the people who are most suited for this. So we have the advantage of a person who's staying, for example, on a third floor, does not have a lift, and the family has to get him down on a wheelchair, or 4 people have to carry him down. Instead of doing that, they just do a teleconsult and everybody is happy, they are satisfied, and we can take care of these patients to a great degree. Um, in in the past, we've seen that the number of percentage of patients who actually said that they've benefited from interventions such as a change in medications, being referred to a specialist for review, for a subspecialist, or even further evaluation of illness and inpatient care, the percentage of these patients are steadily going up with the use of these. Dr. Mittal also has gone through all these points. I won't repeat them. I want to tell you that it is important for neurologists here to be able to be connected to all these patients. I, for example, connect to many patients overseas, and I can speak to them at times that are convenient to them also. So if I'm speaking to somebody in Australia, I often do it at the fag end of the day when it's, in the beginning of the day when it's already later in the day for them. So there are many advantages of using these technologies. The patients are at home, they're not sitting in a clinic, they're not getting hassled with the crowd. They are in their comfort of their home. You can easily tell them if an appointment is delayed, they continue with all their other activities. So I have, small little things which are there are also a great advantage of telemedicine. This helps both patients and doctors greatly. Now, I just want to show you a couple of slides in addition, and this is the source of this is the National Health Services in the UK. This is, and you can see in 2019 and 2020, and you can see the increase in telephone consultations that have happened in the year 2020. There was a trend of an increase even prior to 2020, as you can see, and this has actually steadily grown. So face-to-face consultations are actually going down in the UK even prior to the pandemic occurring. Again, in the US, and the source for this is The Economist, the latest Economist. This article was published in that. And again, in the US, and in the US, let me tell you, there are about 12,000 neurologists for a population of about 350 million people, whereas we have less than 2,000 for a population of 1.4 billion. Even there, you can see that in the fourth line here, saw a doctor or sought medical help virtually. You can see that increase here post-COVID. You can see prior to COVID what it was and post-COVID. So I'm showing you two different situations. Even in the West, as compared to our country, in the UK, there was an increase in telephone consultations even prior to COVID, and that has steadily gone up. And here in the US, you can see clearly that post-COVID, there's been an increase, just like our country. So I think I just wanted to share these slides, and I think Dr. Mittal had covered most of the other points that I wanted to make. So I'll just hand over back to Dr. Agarwal to take this meeting further. Thank you.
Thank you, Raj, for a elaborative discussion on the neuro. And with these two, we end up into a neuropsychiatry as a whole. But the important thing is that when we talk, then I initially said you need to be scientifically, you need to be ethically correct, and also you need to be legally correct. In a neuro or a psychiatric consultation, what you require is an established relationship. You know the patient, so you only require your first consultation has to be very, very clear that it establishes a relationship between you and the patient. So it has to be based on the visual appearance of the patient. So that visual appearance on the first is very, very, very important. Telephonically, it's not possible. If you're doing a WhatsApp call, unless you are doing a WhatsApp video call, the connection may not be correct. The first relationship with the patient is impossible. When I was the national president of IMA, I clearly came out with the guidelines that why establishing a relationship is important. A female patient may be speaking the voice of a male. A male patient may be speaking the voice of a female. The patient may not be in the same state where he is talking. So therefore, you need to establish, I know the patient. That's the only legal requirement which is required. Now, question comes is that there is a platform like CTC, and tomorrow somebody can come back and say, Dr. R.V. Anand, Dr. Rajshekhar, Dr. Sunil Mittal, Dr. Vishal, and Dr. K.K. Agarwal are promoting a particular brand name of a platform. So when we are talking about a brand, whether it is allowed or not, it is 100% allowed. Why? I must clarify, because if any doctor wants to talk about that I have a clinic on C2C, it is allowed to him, and I'll read out that. When I see the guidelines, tools for telemedicine, the government of India says RMP, that means you and me, may use any telemedicine tool suitable for carrying out technology-based patient consultation, telephone, video device connected over LAN, WAN, internet, mobile, etc., etc. Then this says chat platforms like WhatsApp, it's a brand, Facebook, Messenger is a brand. Then this says Skype is a brand. So therefore, government permits, as we talk about on a hospital, and we talk about the hospital name, hospitals are no more considered as a brand of a drug. Similarly, a platform is no more a brand of a drug. It's a platform. So therefore, we now will discuss one such platform which is available for neurologists and psychiatrists, and that is a C2C platform. All of us will look into it, see into it. All of you can evaluate it. It is one thing which can give you an ease of practice for all the parameters we have talked about. So I will now speak a person who was having patience, because we are late by almost 10 minutes. Patience is dhairya, sheel is bina gusse ke dhairya karna. So dhairya sheel Kate Deshmukh will now present overview of CTC, current and newer future offerings of CTC. This is like a platform, like any other platform, and he's going to talk about his platform, and all of us are free to give our opinions on that particular platform. Over to you, Dharishan.
Thank you so much, sir. Thank you very much, sir. Let me also take this opportunity to thank Dr. Mittal and Dr. Reddy for setting up the context. I'm so sorry. Pardon me, sir. I just need to mute my video because I am, experiencing some bandwidth issues. So very quickly, sir, I would take this opportunity to highlight the gaps which are currently there in the offering which are available in the market when it comes to the telemedicine platforms which are available in the market. So what we have observed, sir, is definitely they do have a limited doctor-centric approach. And how C2C will help to overcome this? The core objective of C2C, sir, is, we have kept doctor at the center, and C2C is providing a virtual clinic for each doctor with full support on patient outreach initiative. Sir, the genesis of the C2C, in fact, happened before C2C launched in the market. We, in fact, did a very extensive research with close to 2,000 doctors spanning across the specialties, across the therapy areas, including neuropsychiatry. And based on their feedback, the current C2C platform which you are using for your teleconsultation needs are there available in the market. At the same time, sir, the gaps which we have observed is about on the limited ability. Post consult, you always face a problem of how you can get in touch with, or how you can get in touch with the patients once the consultation is done. So to overcome this particular limitation also, sir, what we have introduced is a patient education module which enable continuous interaction with your patients, where we can share best practices or knowledge nuggets with your patient, and it will definitely have a more holistic digital interaction engagement with your patients. The biggest question always arises when it comes to the teleconsultation platforms which are currently available in the marketplace about the loyalty of the patients. But that is not the issue when it comes to a Connect to Clinic platform. When you are using the Connect to Clinic platform, sir, Connect to Clinic platform provides a unique link to each of the patient. So doctor can share a unique link with his patient so that he can ensure that it's not like a marketplace model wherein patient can switch to other doctors. So just to put it in a simple words, like, we always use the Ola or Uber taxis, where, it's the one Ola or Uber is not available. Definitely we are assured that, the next Ola or Uber can be available where we can hop in. But that is the biggest advantage when it comes to C2C, where C2C provides a unique link to your patient, so patient will stays with you only. It's not like a marketplace. So this is the biggest advantage of using Connect to Clinic teleconsultation platform. Major issue again experienced by the doctors and patients are like about the hidden charges and heavy service charges. Other platforms in the market are heavy on service charges and few hidden charges that definitely leads to excessive monetary burden on the patients. But when it comes to C2C, we do not have any hidden charges, and we have the lowest service charges in the industry, which is at minimum at 6%. Just to emphasize over here, C2C is not a profitable organization. C2C works on the principle of non-profitable organization. C2C's genesis is to cater to the needs of the doctors. It's as a service to the doctor fraternity. The biggest, again, the issue faced by the doctor fraternity is about the data security. So this is the major concern amongst the doctors, that their data would be safe or can be misused for other uses. But let me assure you, doctors, that C2C follows the most stringent safety norms and is compliant with international security norms like HIPAA. So C2C is one of the few platforms available in India which complies to the HIPAA guidelines. Moving ahead, if you see the numbers which are appearing on the screen, these numbers talks about, the thousands of doctors and patients, how they are benefiting from the C2C platform. In the short span of 5 months, close to 22,000 plus doctors are onboarded on Connect to Clinic platform, and more than 6,000 patients has got their consultation done on the Connect to Clinic platform. If you see the ratings which the doctors and the patient has given for the platform are always in the tune of 4 and plus. So that talks about how, the unique value proposition the C2C offering to the patients and doctors alike, and it has definitely propelled C2C as a rapidly moving platform, and it's on the verge of becoming the leading digital engagement platform in the Indian context. Connect to Clinic is not only a telemedicine platform, it's a one-stop solution which will definitely help you in your practice management. Just to start with, although Connect to Clinic starts as a teleconsultation platform, and just me re-emphasis on few of the points, like it's very simple, secure, and reliable. You can set up your clinic on the platform within minutes. It's very simple to set up your clinic on the Connect to Clinic platform. As I already mentioned, that when it comes to security of the platform, Connect to Clinic always abide by the international levels of security. It is HIPAA compliant, and Connect to Clinic also adheres to the MNC guidelines. It also, let me also emphasize on the reliability of the platform. Connect to Clinic offers the industry first feature, like the payment after consultation is being credited in your account in 24 hours itself. It also offers a virtual link to your patient so that your patient stays with you. There is nothing like the marketplace where patient can search for the same specialist on the marketplace. So that is not the possibility with Connect to Clinic. And at the same time, the Connect to Clinic platform offers the flexible slots and free structure based on whether you are approaching, your patient is approaching you for a first consultation or for a follow-up consultation. C2C also offers a unique patient engagement module for doctor, and which definitely is the paradigm shift when it comes to moving from a mere teleconsultation platform to being the most superior platform which offers a holistic one-stop solution to deepen your relationship with the patients. A doctor can definitely stay in touch with the patient pre-consultation as well as post-consultation, where you can guide them on how they can manage their indications effectively. The Connect to Clinic platform also helps patient in getting the regular reminders and advice from the doctors. When it comes to Connect to Clinic also offers end-to-end digital engagement. Just to highlight few of the uniqueness of the platform, as I already briefed upon, that the disbursement of the consulting fee within 24 hours, this is the biggest advantage and the uniqueness of the Connect to Clinic platform. It is very simple and flexible. You can make your consultation slots available for the patients in the gap of either 15 minutes or 30 minutes or 60 minutes based on the type of consultation. You can also set your fees according to the type of the consult, whether it's a first consult or a follow-up consult. And it also helps you with the auto reminder for the follow-up consult. So automatically from the platform, auto reminder goes to the doctor as well as to the patient that his appointment at the upcoming appointment prior other 24 hours or 48 hours based on the doctor's guidelines. As I have already briefed upon the guidelines which we follow, it is one of the secure most platform available currently in the Indian context. And at the same time, it also offers, you can reach out to the patient without any additional cost incurred. In fact, the Connect to Clinic platform is the first and the only platform in India which offers the patient engagement module, where you can the objective, there are the two objectives which we want to approach and address with this particular patient engagement module, where for the doctors, we want that doctor should have a deepened relationship with patient by sharing the best practices, by setting up the smart reminders for post consultation follow up, and at the patient level, the patient engagement module will help in managing the indications effectively through regular reminders. Doctors can share the knowledge nuggets with the patients, and you can also remind a patient for his vaccine upcoming treatment, or you can also remind him for the pathological test as well. Moving ahead, C2C, as I briefed you, we have kept doctor at the core while building this platform. And based on your feedback, we are always, trying to seeing to it that we are evolving with your feedback. So doctors, let me also emphasize on one of the very important point, that the Connect to Collecting, although it's a digital platform, but you can use it as the offline platform. So few of the unique features, like if you are running out of the consult time, you can extend your consultation slot on the fly. Like when you're in the midst of the consultation, you can definitely extend your consultation time when you are, the consultation is ongoing. As you know, we are experiencing all the time, there are internet fluctuations, which at times leads to a disturbance in the audio visual frequency. So where, we also offer you a auto e-prescription saver, where, at the time of consultation, your consultation get interrupted, but at that point of time also the platform will save your prescription. It will be available for the patient just to go through whatever you have prescribed him for. At the same time, the Connect to Clinic platform also create a prescription at your convenience. Even though your consultation is over, you can modify the prescription after 60 minutes of the consultation time is over. The Connect to Clinic platform also offers a 360-degree patient view, where you can witness, you can have all the patient data, patient history available on the platform. Not only that, doctors, now there are coming, we are also improving on our commitment towards you, and there are few other modules also which are very, very soon we are going to launch. Like, you can engage with your patients like never before, where you can share the curated content. A platform will offer you a curated content, or you can create your own content and you can share that content with the patients as well. You can also share the latest news and medical findings, where we are now on the verge of launching the micro nugget, which will save your time and keep you posted on the go on the recent and relevant medical happenings. The biggest talked about a feature, which is very soon it will be launched and available for you to use, where you can exercise full flexibility, where a three-way audio visual facility will be available, where along with doctor and a patient, now going ahead, a caregiver also can join the call. As Dr. Reddy was mentioning in his talk, that currently the senior citizens are the suitable candidates for the teleconsultation platforms, where the caregivers who are not residing along with their parents can join this teleconsultation call from a faraway places as well. So doctors, just to highlight, the Connect to Clinic platform will also help you to reach out to your patients at no additional cost, where the Connect to Clinic team will help you prepare your customized e-cards. You can send the SMS with the help of the Connect to Clinic platform, where you can reach out to your patients with a follow-up or a treatment. SMS can also be sent through the Connect to Clinic platform. You can also reach out to your patient with the use of the social medias like Facebook or WhatsApp. The Connect to Clinic team will also help you in building your customized prescription pads or visiting cards along with the QR codes printed on it, which will help your patients to reach out to you from the convenience of their homes as well. Not only this, now as the changing times and very fastly as the Indian, we Indians are also adopting to the digitalization. So to keep up with the current scene, we are also now available as a Connect to Clinic application available on Android and iOS devices as well. So in a nutshell, the Connect to Clinic is a one-stop solution. It's not merely a teleconsultation platform, but it's a 360-degree doctor and patient engagement module, which we are envisaging in near future. Thank you very much for your time. And with this now, I would again request Dr. Agarwal to take us ahead with the.
Thank you, Dhairya,
Thank you.
for discussing in great detail about C2C.
Thank you.
Can I have all the panelists? Now we'll go for a panel discussion as a part of session 2, which I'm going to moderate. Let me invite Dr. R.V. Anand, who is a consultant psychiatrist in Chennai. Then can everybody be put down on a spotlight? Ritu, start putting them on spotlight. Then I have Dr. Sunil Mittal already being introduced, Dr. Rajshekhar Reddy, and I'm going to call Dr. Vishal Chabra, who is a consult psychiatrist in Delhi. And myself, put me also in the spotlight. So all of us, we are now going to interact with each other in 2 parts. The first part will be your personal experiences of telemedicine. And the second part will be a rapid fire where we will remove all the doubts of ourselves or of the people who are watching this program, any myths, any facts. There, my role as a past member, Ethics Committee, Medical Council of India, and 11 years in Delhi Medical Council will also come my experience in solving many problems related to Medical Council of India ethics. So I'll start with Dr. R.V. Anand. So as we have a short of time, we may extend the program. We are supposed to finish at 4:35, but we will take 10 minutes extra and we will finish at 4:45. This portion will be approximately 20 minutes. So I would like 1 minute each to share your experiences so that we can come back to more discussion on the issues related to telemedicine. Yes, start with Dr. Anand.
Yeah, I find this telemedicine platform, especially Connect to Clinic, very useful, especially for patients. But sometimes patients find it difficult to log into the video platform provided in the link. Because we have to wait for some time, 5 or 10 minutes. Valuable time is wasted sometimes. But most of the times, the connection is very easy. And as a neurologist, I find it very convenient because the neurological conditions are diagnosis is based upon history again. Then examination wise, it's a mere formality even in the face-to-face setting. So Connect to Clinic video platform provides an ample opportunity, especially for diagnosing conditions like in different movement disorders, epilepsy, and for example, as Dr. Rajshekhar Reddy had put out, when a patient comes with a status epilepticus or a breakthrough seizure, we can offer immediate treatment before the patient comes to the hospital for a face-to-face consultation as an immediate measure. I find a slight drawback or a disadvantage in that the conference call is not possible in the video platform. If that is introduced in the link, so that the patient's attendant may be somewhere, as Dr. Rajshekhar Reddy had put out, the caregiver in elderly patients, or a close attendant maybe in a remote place. So connection by conference call or conference video would be very ample and helpful in this platform in the days ahead.
Thank you, Dr. Anand. Both the suggestions are absolutely good suggestions, and the company should look into it and incorporate it, because no doctor would like to waste even a minute. If the patient takes 5 minutes of his time and the time is limited, that connectivity will cause a problem. But one thing is also clear, that if it is a follow-up consultation and your medical relationship, your first relationship has been maintained, and then you can even go for a non-video consultation because you recognize the voice, you recognize the family. So many times, even in Zoom conference, we say that in the conference also, when the link is not there, you say, I'm taking my photo off so that my connectivity improves. So that's the problem of the government, not of an app. It's a connectivity problem. So if the connectivity is poor at the end of the patient, he will have to disconnect his video and then connect. His voice will become clearer. So that therefore you require an established relationship in the first instance. In the second instance, if you have seen the face of the patient, then you say, okay, you now disconnect the video and talk to me. The connectivity will automatically come. That's a technical hitch with that. Now I come back to Dr. Sunil Mittal.
So,
Yes, your experience about telemedicine, personal experience, 1 minute.
right. My experience has been very good. Like I said, psychiatry blends easily to.
So are you now a psychiatrist of India, psychiatrist of Delhi, or a global psychiatrist?
Well, most of my consultations are from Delhi, NCR, but a large number are from other parts of India,
So
and a
therefore
few
now
from
each
across
one
the
of
world.
you,
So,
each one of you, abhi tak people used to ask who is a good psychiatrist in Delhi. Now you can, all of you, Anand can say I'm a global neurologist, Raj will say I'm a global neurologist.
most certainly, sir. Most certainly.
Yes. So all of you should start labeling yourself as a global psychiatrist or a neurologist. Go ahead.
So patients seek me out from all across the world. So no doubt about it. So there's some issue about legality, about jurisprudence in the sense what will be the jurisdiction. That's an unsettled matter. You don't want to be sued in the US for a service being provided from here. But yes, so a large number of patients I have are from the whole subcontinent, and then quite a few from Australia, from the Philippines, from Canada, from the US, other elsewhere in Europe, and of course the Middle East. The experience has been overall good. It is very smooth. Patient satisfaction is also, at least in psychiatry, fairly high. One can also, like in the case of neurology, for behavioral disturbances, even if the patient is not cooperative, video clips actually can help us formulate, because there could be episodic behavioral changes, and otherwise the patient is talking fine. So those can be viewed, prescriptions can be made. Some of the limitation we have is the actual connect the patient might feel. That's one. The second is one of the limitations is the prescription medicines in psychiatry that one can prescribe are often limited by law. What medicines one can prescribe, especially when it comes to those who may be overlapping with medicines with the NDPS or Schedule X. So that's the other one. But I think it's going to grow and these things are going to evolve. It's a dynamic field.
I find
yes, Anand.
I find patient needs a hard copy for prescriptions, especially psychiatric medicine, sedatives or hypnotics, for in the pharmacy provided.
Yes. So hard copy. We'll answer them as we finish up the personal experiences. I've written down the hard copy and the drugs. We'll talk about that. Quickly, Vishal, another psychiatrist.
Yes, sir. Very nice to be with you, sir.
Go ahead, your personal experience.
So, sir, I've tried telemedicine for the last 12 years, sir. I worked with 2 startups in Delhi also. But the problem they never took off is because, most importantly, the client was not ready to go for telemedicine. You will do it for remote people, but people were not ready or not comfortable with the technology. Thanks to this pandemic, people have opened up to this view that they can reach out to you on a video call or audio call, and it's comfortable. So that is happening, sir. Another thing which I have discussed before is the bandwidth issue, which is all steadily improving, and the cumbersome technology. The reason people use WhatsApp much more in India is because the ease of technology. I've used this platform C2C since the inception. They were interacting with me also when they were preparing this app. It is still work in progress. It has some very good benefits in terms of the picture quality, the video quality of interaction is very nice. That is very stable. and there's also a time limit. So you can sometimes when you want certain patients to, I think we want to end it and we have to move on to the next patient, so the video call by itself goes off, so that is a good thing. But sometimes when you're talking and suddenly this connection thing happens and the time limit is going on, so now they've introduced this, we can extend the time, and that's a good thing. So I think this platform needs to become much more friendlier. As Dr. Anand very rightly said, if I want to interact with family members, we can have a collective call, like a Zoom call. I think that is what we need to add in this. And this needs to be much more easier for less tech savvy people to be used. Because I've given it to certain, from tier 3 cities also, but they could not use this platform because they didn't know how to make an online payment, and all those issues were there with this. I think that is very important, sir. We need to make this much more easier, friendlier for people, so that not just Delhi or urban people, but people in rural India or suburban areas can also reach out to us.
So this corona has made Vishal's practice more Vishal. Rajshekhar.
Thank you, sir.
Thank you, sir. I think, again, most of the people have covered most of the points. I'm going to just talk about a couple of things that I think that should be highlighted as far as my experience with this goes. The first is that, like we don't like waiting, I have noticed that patients who are at the receiving end of the video consult also don't like waiting. So you have a patient who's sitting at home and he's been told 11:15. Now, what happens is that when he comes to the OPD and he sees 10 patients sitting there, he may wait for 45 minutes, 1 hour, knowing that doctor is very busy. Sitting at home and not having anything else to do, he will suddenly at 11:15, 11:20, 11:30 send a message. So I think there should be, for all these consults, a method. And it's difficult for the secretary to keep doing this because sometimes it's a very dynamic thing to send them a message saying that, your appointment is delayed, do something. And then some of these people actually, while they're doing these consults, have taken a little window in their office in between a meeting because they think this is super. Like, I have a meeting from 10 to 11, another meeting starting 11:30 to 12. So I will do my consultation with the doctor from 11 to 11:15 or 11:15 to 11:30. So unfortunately, in India, it's been to a great extent a volume practice. And much as we'd like to call ourselves, spending a lot of time, we really don't spend that much time as compared to people in the West. So it is a volume business, and that can be a little bit trying. So I've had, suddenly there'll be 5 patients who are not being done at the appropriate time, jumbling in and coming together, and I'll be getting messages and I get a little stressed out about that. And that can happen once in a while. The second point I want to mention here is that the amount of screen time that we are actually being exposed to. So today, if we start doing our work like this also, our entertainment is like this anyway, because we go back home and maybe watching television or whatever else. We're doing this all the time, and you're looking at your smartphones for reading articles and reading everything else. The little bit of strain that we are getting as a result of spending too much time on the screen, especially with a video consult, over the days can possibly take a toll, and we must be mindful of that. That's the other thing I'd like to talk to, doctors about. These are the 2 points that I see, which are a little, have been of concern to me as time has passed. Now, if I start seeing, like many people I know, good psychiatrists, good neurologists, good physicians, will be seeing 40, 50, 60 patients a day. Now, if you start doing 30 video consults a day, and if you do that 6 days a week, I'm not sure how far you can sustain that.
But that's in your
Just
hand.
to address,
Number of patients are in your hand. You can reduce, you can increase, you can pass it on to, if you are busy, you can pass it on to Vishal. He will be happy to do that.
I will.
But sir is
I'm going to take some rapid fire questions. First,
sorry to intervene, just to address the concern raised by Dr. Rajshekhar and Dr. Vishal, sir. I would just like to, take few seconds of yours. So as far as, sir, the Connect to Clinic platform is concerned, the platform will give the notification through SMS once, the doctor joins the meeting. So patient will automatically get the notification that doctor has joined the meeting. So that is, very convenient for the patient. And sir, as far as you know, the patients who are not very friendly with they are not that techno savvy. So we do have 24/7 customer support team. The customer happiness team will definitely help patients to book and join the appointment. Thank you so much, sir. Thank you.
So I'll come back to some rapid fire. One thing was asked was that patient requires to have a hard copy. No more today. They can take a printout and keep it, and that's valid in the court of law. So therefore, whenever you send them a copy, whichever way you want to send them, they have to print it out. Even yesterday, I got an award from IMA. It was an E. I have to print it out and frame it myself with that. So you are hard copy is no more necessary, not a necessity by law, as long as you are sending it by any of the means with that. Then another thing which came was drugs which are not under the, you cannot prescribe. So remember one thing, you are not right to write certain drugs, but you can write continue these drugs. If you write the word continue, and if the patient is on XYZ, which you cannot prescribe, but nobody can stop you in writing that drug, continue that. The word continue saves it from legal responsibilities because the patient is already on. So if the patient is already on a particular drug, so patient has to come to you only once in a year. Rest of the time you can say continue. Normally we are not in a habit of writing the word CT. We like to prescribe that drug, then you end up into a problem legally because whether it was prescribed now or earlier. So always use the word CT. CT means continue. Say for example, I don't want because we are live on the program, certain things. The third thing which talks about is international patients. Now, as on today, they can't file a case in the US. And then if they want to, and if you want to safeguard yourself, take a donation. Instead of taking a fee, take a donation to your charity, and then you say, I'm giving free consultation. So that charity is also for you. You're supposed to do 10% charity in any way. Use that money for charity. And you say, I'm giving a free consultation internationally. And so I don't think so with that, that patient may file a suit against me for a consultation for, I don't see any reason. You can take a donation and do that with that. Another question which came was of WhatsApp. WhatsApp versus non-WhatsApp. Now remember one thing, that the first case which was filed in South was a case of WhatsApp, a message which got leaked. There was a patient confidentiality message which got leaked. Remember, WhatsApp is not in your hand. Your WhatsApp is managed by your secretary, or WhatsApp is managed by your family, or WhatsApp is managed by everybody who has your phone number. If you have your phone number, your WhatsApp, you may be live on your computer, and you simultaneously may be also live on your WhatsApp. So WhatsApp doesn't give you secrecy and privacy. And if you really want to see the meaning of this WhatsApp privacy and secrecy, you must see the serial Harshad Mehta, that he made billions only because of an insider information. So if your WhatsApp shows that you are seeing a celebrity, and if he's shown to have a celebrity or a politician or an industrialist, and that if your WhatsApp gets leaked that he's on the following medicines, the market will go up and down. So you have to be all of you are senior doctors, make sure your privacy is maintained. WhatsApp cannot give you privacy. No way, because your WhatsApp will be, most of the time you will say, I'm busy in a conference, you will give your secretary, take my phone and keep it with you. And you haven't, you can lock your a clinic set, but you cannot lock your WhatsApp with the password. You cannot, because you are giving it to the secretary and the information can get leaked. And the first case was similar cases where the conversation between the team of the doctors together got leaked in the media, and the patient sued the doctor that you have disclosed my information in the media. So you have to be extremely common. So WhatsApp, telephone are for SOS. Very good for SOS. Ask them to pay by Paytm. Do a SOS call. You say I've handled. Now come back to my clinic. Go to my C2C and have a next appointment there. So these are very good for 2 o'clock in the night, 1 o'clock in the night, whenever there is an emergency. And that's what Supreme Court has said. that where in such cases where you are in an emergency, mistakes are also allowed. So make sure that we are not doing the mistakes, specifically people who are practicing at a high level, where you don't want your. I can give you a single example that there was a person who was working in UN, and he called up my friend, get me an appointment with Dr. Agarwal. So he got the appointment. I saw him. So my friend called me up. How is he? So I told him हल्का सा blood pressure है और वो ठीक है. So he called him up and says कि Dr. Agarwal से मेरी बात हो गई है, हल्का सा blood pressure. And he got annoyed. He says, how come Dr. Agarwal has? He says, I took an appointment with you through you. That doesn't mean Dr. Agarwal can leak my information to you. So that person was so angry, so angry, so angry. It took me 4 years to settle down. So you have to be very, very clear in your privacy. WhatsApp cannot give you the privacy. No way. WhatsApp cannot give you the privacy. You have to have a service. You have to have a service where privacy is maintained. Privacy is extremely important. So we'll be happy to interact with each other. Sunil, you have any questions to ask?
I think everything has been covered, and like Dr. Reddy also pointed out, while we are going to be looking after patients' health, the online presence all the time, the eye strain, and we should remember that we shouldn't be living at work. You know, we are working, we may be working from home, but it should not turn into living at work for doctors, especially round the clock consultations, because patients find it, they don't have to come to your clinic, they can access you and they would like to speak with you. Let's not give into that temptation. But yes, of course, patient confidentiality, like Dr. Agarwal, you pointed out, is very, very important. The record keeping is important, because the telemedicine policy also specifies that even if you're seeing a patient online, the responsibility of care is the same as actually seeing the patient in person. So the same standards, the same service is expected. So it cannot be that I was seeing you online and therefore, well, this error happened. All prescriptions must carry a statement. This is an online or a teleconsultation, audio or video. The prescription is valid and could be taken. A patient can take a printout. And for us also to maintain a record is simpler, because if you're making an e-prescription or even making a prescription scanning and uploading, the record stays with us. So that also helps. It's not just a record, extensive file notes are the best, obviously, but those are also easy to keep in an online platform. The fee collection has been is a challenge. The digital connectivity is a challenge. The last mile connectivity to remote areas can be sometimes difficult. Most if you're looking at internet connectivity, and people might therefore, like has been pointed out, might find WhatsApp simpler. Also, I think the fact that since this technology is here to stay and is going to evolve, so must we change and find off-screen time, like Dr. Reddy pointed out, that we don't suffer from eye strain. And in the beginning of the pandemic, I remember when I was using, a screen, and patients would still like to connect on a WhatsApp. So I had a small, phone there. 2 hours, 3 hours, and I'd get neck pain, I'd get shoulder, all the stiffness in my upper back muscles, eye strain, and I don't get headaches. And once I had a terrible headache. And so the practice then changed to accommodate some more gadgets to make sure that this is simpler.
So you have two choices: either you take the entertainment out and come back to practice, or you practice and. So I mean, in any way, we never had these questions when we were watching TV and working on games. And why are we talking about these questions when we are practicing with that? So one thing I want to caution to everybody, whether you are aware or not, take it for granted that you are being recorded whenever there is a consultation. Take it for granted, whichever platform you are, telephone, WhatsApp, Google, Zoom, C2C, whichever platform you are, take it for granted you are being recorded, and take it for granted a mischievous person may be putting you on live on Facebook, his consultation with you. That's possible because these softwares are now available. where whatever is on my screen, on the phone or on the tablet or on the computer, it can straight away be live on a Facebook. So that every doctor should be cautious about. And that gives us an opportunity to behave patiently with the patient, be soft with the patient, and never get angry on the patient, and be scientific. So I am not afraid of that. So I'm basically telling you that whichever software, whichever, whether it is library, whether it is any program, even parliamentary proceedings, you can put it on the Facebook Live, on your Facebook Live, if you are watching a TV on the Facebook, on the computer. So these are the things which I want to caution all the people. That means you now can become a better doctor. And from my uh, our association's point of view, we are very told every doctor, please have one clinic. Natural means all GPs should have a 4 hours clinic in the morning, which is face to face, and 4 hours clinic in the evening, which is virtual, so that you don't have to use your PPE kits twice. You don't have to take them out. So 4 hours you practice, use one PPE kit, go back home, then you practice at virtually. That is what it is going to require. Otherwise, in a clinic, when you have a lunchtime, you go home, come back, and again you say, oh my God, I have to use the PPE again, I have to wash, I have to take a bath 3 times a day. So take it for granted, at least for the next couple of years. Uh, one clinic has to be virtual and one clinic has to be face to face. That everybody should remember, because here there are neurologists and other people are also watching this program. So therefore, it is always better to have two clinics, one virtual and one tele. People who are elderly, they should never retire. They should continue their virtual consultation. So the focus, they were saying that elderly patients, we have a problem, but elderly doctors, no. For them, they have an opportunity. The third thing is that MCD and DMC, the local state will not come back and say that you are using a commercial property in your home. Now you only need a laptop to see all your patients. You can see 100 patients. Otherwise, if 100 patients are waiting outside your clinic, somebody will come back and say, "Mera hafta do," because you are misusing my problem. So when you are talking about this vaccine today, the government said that risk benefit ratio, the benefit is more than the risk. Therefore, vaccine is going to be permitted. Telemedicine today has more benefits than risk. Therefore, everybody should go on to the telemedicine. So before I close, I'll ask each one of you to give final 3 messages each, which we can cut it later on and send it as, make them as viral to the people as a summary of today's talk. Each one of you pick up three messages of your own, starting from Anand to Vishal to Sunil to Rashik.
Yes, sir. Telemedicine is going to stay in the future also, even after the lockdown, after the pandemic is over. Number two, and it is a very easy platform for the patients. They can avoid commuting, as Dr. Rashekar Reddy said, and it's easier for both the doctors as well as the patient. And the third thing is cutting off the consultation by even 6:37 in the evening, even if it's virtual, it is worthwhile, because we tend to lose our sleep and get insomnia rather than continuously using it till 9 or 10 in the night. So it's better to cut it off by 6:30. These are my 3 messages I would like to pass on.
Thank you. He would like to sleep with Anand. So therefore he says cut down at 6:30 ताकि आनंद के साथ सो सको. Vishal.
So 3 messages to the patient. One, that telemedicine is here to stay, and it helps in democratization of healthcare. So this helps in anyone reaching out to you, Dr. Rajshekar, Dr. Sunil, who otherwise person may have to travel all the way from Bihar or West Bengal or Karnataka. So they can easily reach out to you through telemedicine. So telemedicine makes it very easy for patients to reach out to the doctors they want. So it causes democratization of the healthcare. So that is very one. Second, it reduces the unnecessary costs, because a lot of times when patients have to travel, they travel in a place like Delhi, 1 hour to come to see me for 15 minutes and 1 hour going back, plus a person coming next to them. So they save so much of time, energy, and money. which they can save by using telemedicine. And third, uh, telemedicine should become more patient and doctor friendly. So we need better technologies like C2C, and it is a developing platform which will help us, we should do it in more seamless way. The technology should be much more stable so that we feel we're almost talking to the patient as we're seeing patient face to face.
Over to Sunil.
Like all things, technology is pervading into our lives and in healthcare too. And one of the things that technology has brought about is telemedicine, which is the reality today and is going to evolve to become stronger and more pervasive in the coming future as more and more things happen in telemedicine. So not permitted today. You may even have robotic procedures through telemedicine in time to come, which are there, which are a reality, but which will find application. As of now, I'm a psychiatrist. So in psychiatry and mental health, they adapt very easily to telemedicine. And therefore, if you look at healthcare, now healthcare is available to the patient in their palm top, in their hand, in their mobile device, or on their laptop. And why should it not be? Patients can access easily. They can access their doctor. They can access a specialist, even in who's at a distance, because telemedicine covers a critical distance factor, whether it's a geographical distance or it's also a distance of time zones or travel time. It cuts down costs of care. It cuts down on patients, discomfort, and can get other caregivers easily involved into the care process. So accessibility becomes easy, availability of specialists becomes easy, the costs come down, so affordability goes up, and at the same time, the same telemedicine tools can be used to create health awareness, which is dearly required, not only in our country, but across the world. So that, having said that, it is also patient centric, because now patients can actually initiate consultation with the best consultants whom they want to see. Otherwise, they couldn't travel from one city to the other or one hospital to the other. It's also doctor friendly, because doctors can choose to work at more convenient times outside a hospital, outside their clinic, from their own office, in their homes, or elsewhere. Well, you could be at a beach and providing a consultation for all that is there. And the third thing that is happening with telemedicine is, as more and more platforms become available for providing this care, so not just diagnostics, treatment, interventions, and as well as other forms of therapy would be at a distance. Whether it's you're collecting data from the patient, analyzing it and see as you see it, whether it's visual data, it's paper data in picture form, or telemetric data, you're analyzing it and also then able to provide consultation, not just to the patient, but for the point of care physician or any other specialist. So it is the platform which is most comprehensive, I mean, any of the telemedicine platforms. And this is the future of healthcare.
Thank you, Sunil. And lastly, Rajshekhar.
So, thank you, sir. I think again, everybody's covered all the points in great detail. I have 3 points, two of which I think are for patient view and one is from a doctor's view. So there's a definite advantage. A job as healthcare specialist is to take care of the vulnerable, the people who need the help the most. And these are the people, the elderly people, or such people who are incapacitated, who can't come to a hospital physically, who are greatly at advantage with such technologies and this service. The second is time, money, and the the inconvenience that is avoided. Time and money is saved, inconvenience is avoided for both the doctor and the patient. The second point is in favor of both. And the last is a message to doctors. I would still say at the end of it. So we talk about detox. We should also have detox, TALKS. So at beyond a particular point, we would have a situation where one would like to limit the amount that one does this. And like Dr. Agarwal very well suggested very well. So we do a good proportion of it physically and a proportion of it with video consultation, especially those people who really require to do it by virtually, and those are the people that this service should be provided for. And absolutely, this is only going to grow over the next few years. There's no doubt about that.
We can call it hybrid practice, sir. Hybrid practice.
Yes, hybrid practice. So to end, when WhatsApp came, It came from the word WhatsApp, but that's what you used to talk to everybody, what's new with that. Here we are talking about consultation between a patient and a doctor. So consultation from a patient, that is C, consultation to a doctor, that is C. The word to can be written as to numerical or TO2. So C2C basically means a consultation between a patient and a doctor. You can remember this way. It's easy to remember like a WhatsApp. It's easy to remember like a Facebook. So the name is very friendly to the people, C2C. So therefore, two C's here, one for the patient and one for the doctor. Thank you, all of you, Vishal, Sunil, Rajshekharan, and Dr. Anand, and Dhaireshil. And thank you, all of my viewers who are watching this program. And I'm sure this program, even thousands of people have attended, but many more will get a copy of this link. And all of you should watch this program because Christmas is coming and New Year's is coming. You want to give a gift to somebody. The Veda says gift should be given with love. If you send a chocolate to somebody on Christmas Day, the first reaction that will be, "Arey piche rakho, pehle sterilize karo." So the love is gone. So the love is gone. So therefore, anything material you are going to set on 25th of 1st will not be accepted in COVID era. So only distribute either love or knowledge. So therefore, share this video if you feel you like this video. Share this and write down in this and write down at the bottom, Happy Christmas. I hope I'm giving you a, let's say, a Christmas gift for you. So this is the best way to acknowledge people instead of sending them chocolates or mithai or a cake. Send them this video and say Merry Christmas. Thank you very much. We'll be back
Thank you.
with another show sometimes whenever time permits us. We are for you. We care for you. Make sure that we want all of you to continue, live long, not suffer from COVID. Even if you suffer from COVID, don't worry. We all are there to help you. All of you are our colleagues. We don't want any doctor to die of COVID. We don't want any doctor to suffer from COVID. So stay in touch with us or with any one of our panelists. We are there for you. Thank you very much.
Thank you, sir.
Stay tuned.
Thank you, sir. Thank you very much, sir. Bye-bye.